Cardiopulmonary arrest is an emergency event that happens when an animal's heart stops beating and their lungs stop functioning. This prevents oxygen from being delivered to all of the vital tissues and organs to keep the animal alive. Cardiopulmonary resuscitation is a life-saving technique that combines chest compressions with mouth-to-snout resuscitations, which delivers oxygen to the vital organs in order to either keep the animal alive until you get to a veterinary emergency center. You might also be able to revive the animal from the emergency event. CPR needs to begin very quickly after an animal goes into cardiopulmonary arrest. If CPR is not administered within 5 minutes of the arrest, the animal can start to sustain irreparable tissue damage and brain damage. After 10 minutes, it's very unlikely the animal is going to survive. It's important not to give up. Even if an animal does not revive until you get to a veterinary clinic, there is a chance that they can use their advanced medical care to be able to save the animal's life. So let's talk about normal heart and lung function. What you see here is a normal heart pumping. You'll notice that there's a left side and a right side designated by blue and red. The blue side is the right side, and the red side is the left side. There are 4 chambers to the mammalian heart: the right atrium, right ventricle, left atrium, left ventricle. The shape of a dog and cat's chest is very different than a human. Our chests are flat front to back. However, a dog and cat's chest is flat side to side. This puts the heart below the lungs, near the breastbone, also called the sternum, and more to the left side than the right. That is why we perform CPR differently on animals than people. If you're trained to perform CPR on people, please don't use those same techniques on animals. Our anatomy is very different, and therefore CPR is performed very differently. There are many reasons why people want to be trained to perform CPR. Some people want the training to be able to provide the best care for their own pets, while some other people want to be able to protect animals in their care. This might include pet sitters, dog trainers, doggy daycare workers, as well as shelter volunteers. Being prepared is very important, and you're taking the best first step by becoming properly trained in canine and feline CPR and first aid. We often get questions about liability and how that pertains to performing CPR in dogs and cats. Quite honestly, there isn't a straight answer. It's a very gray area in the United States, and most states have no regulations whatsoever. The best information that we can give you is don't hesitate. When we question lawyers and lawmakers, they all say the same thing. To the best of their knowledge, no one has ever been sued for performing CPR and first aid on an animal. It's considered a Good Samaritan act, so feel free to use the skills and techniques that you learn in this training. If the pet is not your own, then this is an important message for you. If you come across a pet that needs help, make sure you try and identify the owner first. Ask passersby if they know who the animal belongs to. This is important because many veterinary clinics have policies that prevent them from performing medical care in animals without the owner's permission. If you do have animals in your care that are not your own, you should have the owner sign a pet care emergency authorization form that you can take with you if you go to the vet in an emergency. Something else to be aware of is that some veterinary clinics, particularly 24-hour emergency practices, use what's called a resuscitation order. A resuscitation order is a form that owners would sign to verify how far they're willing to go for their pet if the animal was in a life-threatening situation. Some veterinary clinics have the owner sign these forms ahead of time. The form is then put in the animal's medical record file for any time in the future that it might be needed. This way, owners don't have to experience more emotional trauma during a life-threatening emergency when they arrive at the hospital and have to make those decisions and sign the form while their animal is potentially dying. The levels of the resuscitation order are red, yellow, and green. Red means that you do not resuscitate the animal at all. So if an owner signs for a red level on their resuscitation order, it means if the animal comes in cardiac arrest, the veterinary clinic will not do any further care. Yellow means closed chest CPR. Closed chest CPR is when we perform manual CPR with chest compressions and mouth-to-snout resuscitation, or in the case of a veterinary clinic, they may do ventilated resuscitations with an endotracheal tube placed into the animal's airway. A green resuscitation means that you allow all options to be administered to the animal in the event of a cardiopulmonary arrest, and this can include open chest CPR. Open chest CPR is not commonly done in veterinary practices and has a low survival rate. However, owners may choose to do this if they want the animal to have its chest surgically opened, and the veterinarian will manually compress the heart within the chest cavity. We recommend, if you are able, to call the veterinary clinic and let them know you're coming. This will allow them time to better prepare for the emergency that you're bringing in. They can have the necessary team members ready to assist you once you arrive. Now let's talk about the steps to performing CPR on dogs and cats. The first thing you want to do before you perform CPR on a dog and a cat is to check your surroundings. Make sure the environment is free from hazards that could cause further harm to the animal or could cause harm to you. If you are in a dangerous area, carefully move the animal to a safer location before starting CPR. Make sure you do this promptly because you need to begin CPR as soon as possible. Next, check to see if the animal is unconscious. A conscious animal does not need CPR. Approach the animal swiftly but carefully. Check your surroundings and move the animal if needed. Try to stimulate the animal by clapping your hands, stomping on the ground, and then gently kneel down and touch the animal. If the animal doesn't react when you stimulate them, you need to check their ABCs. A is for airway, B is for breathing, and C is for circulation. This is also referred to as primary assessment and should not take more than 10 seconds to complete. Primary assessment is used to determine whether or not the heart has stopped beating and if the animal is still breathing. First, you want to pull the tongue out and look down the animal's throat to see if you see any obstructions that might prevent the animal from breathing. If you do, then you need to dislodge the obstruction before you can move forward. Next, you're going to check if the animal is breathing. Bend down and listen to see if you hear breath coming by your ear from the animal's mouth or nose. You can also put your hand on their chest to feel if the chest cavity rises and falls when the animal inhales and exhales. The last part of primary assessment is to check for circulation. Circulation means that the heart is beating and blood is being pumped throughout the body. Take 2 fingers and slide them in the groin area on the hind leg of the animal. When you press between the muscles near the top of the leg, you should feel the animal's pulse. You're not going to count the pulse. You just want to see if it's actually there, which means the heart is functioning. We are now going to demonstrate primary assessment. Kneel down behind the animal and touch them to see if they react. If they don't, pull their tongue out and look down their throat to see if you see any obstructions. Next, you want to listen and feel to see if the animal is breathing. Now, feel the femoral pulse to see if the animal's heart is beating. If the animal's heart is not beating and their lungs are not functioning, you need to now position them to start performing CPR. Because the size and shape of dogs and cats varies quite a bit, there are 4 different positions that we place the animals in for CPR. Each position is assigned to an animal based on the shape of its chest, its size, and also breed characteristics. The 4 positions are average-chested, keel-chested, barrel-chested, and circumferential, which we use on small dogs, cats, puppies, and kittens. Let's discuss each one in detail. The first one is the average-chested dog. Many dogs fall into this position type. The best way to determine what position to put your animal in is hug the animal from above and feel the circumference of his chest. The average-chested dog feels somewhat like an egg-shaped chest, where it's wider at the top and then becomes narrow at the bottom between their front legs. A good example of this shaped chest would be a Labrador Retriever or a Pointer. This is also the default position you would use if you were unable to determine what shape of chest your animal has. For this position, lay the animal down on their right side. This means that the left side of their chest will be facing up towards you. This is important because the heart lays further to the left in the chest cavity. Therefore, when you press down with the palm of your hand on their chest, you will be pressing down directly over the heart. You're going to place the palm of your hand on the tallest point of the animal's chest on the left side. as you can see in the picture here. Let's demonstrate what this looks like. Kneel down behind the animal and make sure it's laying on its right side. Find the tallest point on the side of the chest, lock your fingers, and place your palm above that point. Let's look at the keel-chested position. This position is used on many sighthound breeds, such as greyhounds, whippets, borzois, any animal that has a long, narrow-shaped chest. These dogs have less fat on their bodies, particularly around their rib cage. Because of the long, narrow shape of their chest and the fact that they don't have as much padding around that area, the way we do compressions on these dogs is a little bit different. They still lay on their right sides with their left side facing up, but your hand position will be further down towards their elbow as opposed to up on a high part of the chest like in the average chested dog. Again, kneel down behind the animal, make sure they're laying on their right side. Put the palm of your hand at the very base of their chest for compressions. The barrel-chested position is the only position where the animal lays on its back. This position is used on very round-chested dogs, so bulldogs, some pit bulls, mastiffs, etc. For this position, you can kneel down on either side. You're going to place the animal's forearms at its side, and you're going to put the palm of your hand directly on the center of its chest, right in the middle of its breastbone. Again, place the animal on its back, its forearms by its side, kneel down, put the palms of your hand on the middle of its breastbone, and do compressions. The last position are for the little guys, puppies, kittens, small dogs, and cats. Because the other three positions are far too aggressive for such a small body type, we use what's called circumferential compressions. What we do for this position is lay the animal on its right side, and we wrap our hands around their chest right behind their forearms and compress, pushing our thumbs and fingers together. This particular position does not need to be performed on the ground and can be done on a table or elevated surface. Wrap your hands around the animal as shown in the video here. Press your thumbs and forefingers together to accomplish the compression for these small animals. Let's do a quick overview of your body position when you perform compressions during CPR. For average-chested, keel-chested, and barrel-chested dogs, you want to make sure that you are on the ground and are also on a flat surface so that you can adequately press down and get the appropriate amount of resistance to compress the chest at least a third to halfway down. It's important that your elbows are locked and your shoulders are straight up above the animal with your fingers clenched and your palm pushing straight down. This position is the most effective at compressing the heart to deliver adequate blood flow during CPR. It is used for the average-chested, keel-chested, and barrel-chested positions. Circumferential compressions can be successfully performed on any surface using your hands. CPR also requires the use of mouth-to-snout resuscitations to deliver air to the lungs. This is accomplished by pulling the tongue out, closing the animal's mouth, wrapping your lips around both nostrils, and blowing firmly into their lungs. It's somewhat like blowing up a balloon. When you blow air into a balloon and you feel that resistance, you stop blowing. Same thing when doing a mouth-to-snout resuscitation. Blow air into the nostrils, and when you feel resistance, when the lungs are full, take your mouth away, and the lungs will deflate. This is what that looks like. Pull the tongue out, close the mouth, holding it shut, wrap your lips around both nostrils, and blow firmly. The compression to breath ratio is 30-2. This means it's 30 compressions to 2 breaths. Once you complete primary assessment, and you determine the animal needs CPR, begin your compression to breath sequence, 30 compressions to 2 breaths. You will do continuous compressions and breaths for 2 minutes. This is roughly 4 sets of compressions and breaths. After the 4th set, pause and recheck breathing and circulation the same way that you did when you did primary assessment. You do this to try and see if you have what's called ROSC. ROSC is return of spontaneous circulation. In other words, it means the animal is revived or is reviving. At this point, you can stop doing CPR. If you do not have return of spontaneous circulation, you then start another 2-minute round of compressions and breaths. You continue this pattern until either the animal revives or you arrive at a veterinary facility. Here are a couple other guidelines to follow. When you do a chest compression, you need to press the chest down at least 1/3 to halfway of the total width of the chest. This will adequately compress the heart so that blood will flow to the tissues. No matter what size the animal is, you're going to compress the chest at a rate of 100 to 120 beats per minute. That's how fast you are doing the compressions. We've provided a folder in this module that contains a collection of songs that you can use to practice CPR compressions. These songs all have a rhythm between 100 and 120 beats per minute. If you subscribe to a service such as Apple Music or Spotify, you can download playlists of songs to perform CPR to. Ironically, 2 of the most popular songs to perform CPR to are Staying Alive by the Bee Gees and Another One Bites the Dust by Queen. Let's put it all together. At the completion of this video, I highly recommend you find a stuffed animal and practice CPR yourself start to finish. Keep practicing until you feel comfortable enough that you could just do CPR without even thinking about it. It should be second nature.